Welcome to NurseEdScholar. I'm so glad you're here for some helpful nursing content. I've chosen to use AI faceless videos like this one because I'm not very comfortable being on camera, but I still want to bring valuable information directly to you. These videos are designed to be short and focused, perfect for busy nursing students who are juggling school, work, and life. Each one is packed with the key nuggets you need to succeed in nursing school and beyond. So please take a moment to check them out and be sure to watch all the way to the end. Thank you for being here, and welcome again to NurseEdScholar.
How to Analyze an Arterial Blood Gas, ABG. A practical guide for nursing students. Arterial blood gas, ABG analysis is a crucial skill for nursing students to master, as it provides critical information about a patient's oxygenation and acid-base balance. It assesses the degree to which the lungs can supply adequate oxygen and remove carbon dioxide, as well as the degree to which the kidneys can reabsorb or excrete bicarbonate. Determining whether an acid-base disturbance is compensated or uncompensated is crucial for delivering effective patient care. This video simplifies the steps of ABG interpretation, focusing on practical application in clinical settings. What is an ABG? An ABG is a laboratory test that measures key components of the blood to assess respiratory and metabolic function. It is used to determine the extent of compensation by the buffer system and includes measurements of pH, oxygen levels, and carbon dioxide levels in arterial blood. Unlike other blood samples obtained through a vein, a blood sample from an arterial blood gas, ABG, is taken from an artery, commonly in the radial or brachial artery. The main elements analyzed in an ABG report are pH, indicates how acidic or alkaline the blood is, normal range 7.35 to 7.45. PCO2 reflects the partial pressure of carbon dioxide in the blood and respiratory function, normal range 35 to 45 mm of mercury. HCO3, bicarbonate concentration, which represents metabolic activity regulated by the kidneys, normal range 22 to 26 milliequivalents per liter. Note, this number can vary based on the reference. PO2, partial pressure of oxygen, which represents the amount of oxygen available to bind with hemoglobin, normal range 80 to 100 mm of mercury. Step-by-step ABG analysis. Step 1. Check the pH. Begin by determining if the blood pH is within the normal range, 7.35 to 7.45. Abnormal pH readings indicate acidosis, pH less than 7.35. Alkalosis, pH greater than 7.45. Step 2. Assess PaCO2. Next, evaluate the respiratory component, PaCO2. Deviations from the normal range can indicate respiratory disturbances. Respiratory acidosis, PaCO2 greater than 45 mm of mercury or high CO2. Respiratory alkalosis, PaCO2 less than 35 mm of mercury or low CO2. Step 3. Examine HCO3. Now look at the bicarbonate, HCO3 level to detect metabolic imbalances. Metabolic acidosis, HCO3 less than 22 milliequivalents per liter. Metabolic alkalosis, HCO3 greater than 26 milliequivalents per liter. Step 4. Identify the primary disorder. Determine whether the disturbance is primarily respiratory or metabolic by noting which value, PaCO2 or HCO3, aligns with the pH abnormality. If the pH abnormality corresponds with PaCO2, the issue is respiratory. If the pH abnormality corresponds with HCO3, the issue is metabolic. Step 5. Evaluate compensation. Finally, assess whether the body is compensating for the disturbance. Compensation can be thought of as the body's attempt to correct an imbalance. Is one system in the body trying to compensate for an abnormality in another system? We can investigate this by looking at the opposing component of the problem, If the other level or component is within normal ranges, then the problem is non-compensated or uncompensated. Ultimately, the body has yet to fix the problem or has been unable to fix it. However, if the other component has deviated from its normal reference ranges, we can consider it as compensation, meaning the body is attempting to rectify the problem. To assess how well it has been able to do this, we need to refer back to the pH. If the pH is not within or close to the normal ranges, then a partial compensation exists. If the pH returns to normal ranges, then full compensation has occurred. A non-compensated or uncompensated abnormality typically represents an acute change that occurs in the body. Uncompensated, the pH is abnormal and either PaCO2 or HCO3 remains unchanged. Partially compensated, the pH is still abnormal, but the other parameter, PCO2 or HCO3, is beginning to adjust. Fully compensated, the pH is normal, but PaCO2 and HCO3 are outside their reference ranges. What you must look at to interpret ABGs. Let's break down the ABG. Problem 1. pH is 7.50, PCO2 is 47, and HCO3 is 32. Is this acidosis or alkalosis? The pH is 7.50, which is higher than normal, so we have alkalosis. Is the problem of a respiratory or metabolic nature? Where else is there alkalosis? The HCO3 is 32, which is high, so we have metabolic alkalosis. Is there any compensation occurring? Has the body tried to fix the problem? We need to examine the other component in this case. What is the CO2? The CO2 level is outside its normal range. It's 47, which is high, so the body is trying to correct the problem. However, the pH is not yet back within normal ranges, indicating a partial compensation. In conclusion, this ABG is an example of a partially compensated metabolic alkalosis. Problem 2. pH is 7.30, PCO2 is 50, HCO3 is 30. Is it acidosis or alkalosis? The pH is 7.30, which is lower than normal, indicating acidosis. Is the problem of a respiratory or metabolic nature? What else is acidotic? The CO2 level is 50, which is high, indicating respiratory acidosis. Is there any compensation occurring? Has the body tried to fix the problem? We need to examine the other component, HCO3. In this case, is it outside its normal range? Yes, a normal HCO3 is between 22 and 26, so the body is trying to fix the problem. Has the body done a good job of fixing the problem? Is the pH back within normal ranges? No, the pH is not within normal ranges, so partial compensation is occurring. In conclusion, this ABG is an example of a partially compensated respiratory acidosis. Now let's look at more interpreted ABGs, but here we're not calculating compensated or uncompensated. First step, look at the pH. Is it normal between 7.35 to 7.45? Does it reflect acidosis, which is less than 7.35, or does it reflect alkalosis, greater than 7.45? Second, let's look at PaCO2. This is the respiratory component. Does it reflect alkalosis less than 35, or does it reflect acidosis greater than 45? Lastly, let's examine HCO3. This is the metabolic component. Does it reflect acidosis less than 22, or does it reflect alkalosis greater than 26? Now let's put it all together. Problem 3. The pH is 7.33, PCO2 is 40, and the HCO3 is 20. What does this indicate? The pH equals acidosis. The PCO2 is normal. The HCO3 indicates acidosis. So here you have an abnormal HCO3, which indicates a metabolic problem. And that is the same as the pH. So you have metabolic acidosis. Problem 4. The pH is 7.59. The PCO2 is 29, and the HCO3 is 24. What does this indicate? The pH is alkalosis, the pH in CO2 are alkalosis, and the HCO3 is normal. PCO2 indicates a respiratory problem and it matches the pH, indicating respiratory alkalosis. Problem 5. The pH is 7.25, the PaCO2 is 61, and the HCO3 is 26. What does this indicate? The pH is acidosis, the PaCO2 is acidosis, and the HCO3 is normal. An abnormal PaCO2 indicates a respiratory problem which shows acidosis, which matches the pH of acidosis, so we have respiratory acidosis. Problem 6. pH is 7.51, PCO2 is 44, and HCO3 is 56. What does this indicate? pH is alkalosis, PaCO2 is normal, HCO3 is alkalosis. An abnormal HCO3 indicates a metabolic problem and matches the pH, so we have metabolic alkalosis. Here are some additional scenarios. Scenario 1. Uncompensated respiratory acidosis, pH 7.30, acidic, PCO2 50, high, HCO3 24, normal. Interpretation. The pH confirms acidosis, and the elevated PaCO2 indicates a respiratory origin. Since HCO3 is normal, compensation has not yet started. Scenario 2. Partially compensated metabolic alkalosis, pH 7.48, alkaline, PaCO2 48, high, HCO3 30, high. Interpretation. The pH confirms alkalosis and the elevated HCO3 points to a metabolic origin. The increased PaCO2 suggests partial respiratory compensation. Scenario 3. Fully compensated respiratory alkalosis, pH 7.44, normal, PaCO2 30, low, HCO3 20, low. Interpretation. The pH is normal but slightly leaning towards alkalosis, so we place pH under the normal column with an arrow pointing towards the alkalosis column. The PaCO2 is abnormal and alkalosis, so we place the PaCO2 under the alkalosis column. The HCO3 level is abnormal, indicating acidosis, so we place it under the acidosis column. The pH of 7.44 is normal but leaning towards alkalosis. Therefore, it is under the same column as PaCO2. We have a respiratory issue. Therefore, we have a fully compensated ABG. Tips for nursing students: always start with the pH to identify the primary disturbance. Use the respiratory, PaCO2, and metabolic HCO3 values to determine the root cause. Memorize normal ranges to avoid misinterpretation. Practice regularly with sample ABG reports to build confidence. Conclusion. ABG analysis is a crucial skill for nursing students, enabling them to make informed clinical decisions. By following a systematic approach to evaluate pH, PaCO2, and HCO3, students can accurately identify compensated and uncompensated disturbances. Consistent practice and application in clinical scenarios will enhance mastery of this essential skill. If you've enjoyed this content, I'd love to hear your thoughts. Please leave a comment, give it a thumbs up, and hit that subscribe button. Exciting things are coming that you won't want to miss. Let's keep the learning going together. Happy studying from NurseEdScholar.